Imagine surviving a serious accident or illness, only to develop an infection while recovering in the ICU. For critically ill patients, even a simple infection can become life-threatening very quickly. Referencing research from the Centers for Disease Control, or CDC, and hospital case studies, I'll explain how infection prevention saves lives. I'll present 3 main points. First, I'll discuss why ICU patients specifically are at an increased risk for infection. Second, I'll discuss the infection prevention techniques used by nurses every day. And third, I'll discuss how the practices improve patient outcomes through real-life examples. First, I'll be discussing why ICU patients are at an increased risk for infection. ICU patients often already have weakened immune systems. Serious illness or injury makes it increasingly more difficult to fight those infections. Many patients often require invasive ventilation or things like urinary catheters or other invasive lines. Invasive medical devices create pathways for infection to enter the body. For instance, central line-associated bloodstream infections, or CLABSI, are among the most common and serious hospital-acquired infections. According to the CDC, CLABSI are largely preventable with proper infection prevention. Second, I'll be discussing infection prevention practices ICU nurses use. Hand hygiene is the first line of defense for our patients. Performing hand hygiene before and after each patient contact is a crucial part of infection prevention. The CDC considers hand hygiene the single most important practice for preventing the spread of infection in healthcare settings. ICU nurses use sterile technique when performing tasks such as maintaining invasive devices. We often disinfect central line ports before accessing them or do things such as changing dressings with sterile technique and removing devices as soon as appropriate to avoid infection. Third, I'll be explaining how these practices save lives. First, using an example from 2003, hospitals participating in the Michigan Keystone ICU project implemented a simple checklist that included hand hygiene, sterile barriers, and proper central line care. The project decreased central line bloodstream infections by up to 66%, preventing thousands of infections and saving countless lives. The second example I'll be using is the CDC reports that hospitals following evidence-based infection prevention practices have dramatically decreased CLABSIs nationwide. Because of these prevention efforts, thousands of patients avoid life-threatening bloodstream infections every year, demonstrating that consistent infection prevention directly improves patient outcomes. Now I'll be summarizing. First, I explained why ICU patients are extremely vulnerable to infections. Second, I discussed some of the many infection prevention practices used by ICU nurses every day. Third, I described how these practices save lives through real-world examples. Infection prevention may seem as simple as washing hands or cleaning access ports, but in the ICU, these small actions can mean the difference between recovery and life-threatening illness.